Be performing a carrying angle assessment. The purpose of this assessment is to look at the overall angle between the humerus and the radius and ulna and to see if there's any potential strain being caused on the elbow itself. Hi Liam, my name's Olivia. I'm a student physical therapist at the University of Pittsburgh. Is it okay if I do a quick assessment on you today just to check out your elbow to make sure that there's no misalignment and that we're not causing any strain on any of your muscles?
Yeah, totally fine.
Awesome. Can you go ahead and flip your arms so that your palms are forward? So we're going to have the stationary arm on the humerus, the axis at the elbow joint, and then the moving arm in between the radius and ulna. So he is at right about 8 degrees. That is within the normal range for males. Typically, whenever we perform this, we would want to do it bilaterally if we see any type of misalignment at the bones or at the joint, and if we saw any type of swelling or any type of increased versus decreased angle difference just from observation. A normal range for males is 5 to 10 degrees, and a normal range for females is 10 to 15 degrees. If they are below the range, this would be referred to as cubitus varus, which can lead to peripheral neuropathy, increased strain on the musculature, and if they were above the range, this would be referred to as cubitus valgus, which can also lead to strain on the musculature, altered body mechanics, or peripheral neuropathy. We may also potentially see some misalignment at the bone structures, which could indicate a potential fracture, subluxation, or dislocation.
Today, I will be performing one of the 3 tests for posterolateral rotary instability, the lateral shift and apprehension test, and these tests are used to test the integrity of the LUCL or LCL complex of the elbow to see if there's any instability or any laxity in these structures, which can usually be seen after trauma, like a fall on an outstretched hand. Usually these tests will be done bilaterally to assess any asymmetries from side to side, but for the purpose of this video, we will be doing them unilaterally. A positive test would be a reduction in extension or a subluxation at 40 degrees of flexion. The patient may also note any apprehension or any feelings of giving way in the lateral elbow, and we also may feel a clunk or note a skin dimple. Hi, Haya.
Hi, Zamina.
How are you today?
I'm good.
That's good to hear. Today I'm going to be performing a test to test something called the ligaments on the outside of your elbow right here. I know that you said you've been feeling a little pain and instability, and so with this test we're going to assess to see why that is and if the cause is those ligaments on the outside of your elbow here, okay? And so as I'm doing this test, I want you to completely relax your arm and let me move you. And while I'm doing it, I want you to tell me if you feel like your elbow is about to give way or if there's any pain or discomfort, okay?
Okay.
All right, let's do it. As I do this test, just let me move you. I'm going to move you in and out of a position with your elbow, and let me know if you feel any pain, any discomfort, any giving way of that outside of your elbow, okay? All right, so what we're going to do is I'm going to put her arm into full flexion. I'm going to put her into supination, and then I'm going to apply a axial load and a valgus force at the elbow while moving her into flexion and extension. All right? Remember to let me know if you feel anything. All right, ready? Do you feel any pain?
No.
Today, I will be performing the Tinel's test specifically at the wrist for median nerve entrapment. In the clinic, I will perform this test bilaterally, but for the purposes of this video, I'm only going to perform it on one side. There are 2 ways that we can perform this test. We can just simply tap 4 to 6 times at the carpal tunnel region, or we can tap from the index finger all the way up to our elbow. Hi, Jamima.
Hi.
So today we're going to do a test called Tinel's test, and what this test does is basically just to see if the numbness and tingling that you've been feeling down your hand is because of a specific nerve that basically helps make you feel in this area and move and all that good stuff. Okay? So what I'm going to have you do is, can you just put your hand up here like this? Okay, so what I'm going to do is I'm going to tap this area 4 to 6 times.
Okay.
Ready? Okay, so 1, 2, 3, 4, 5, 6. Do you feel anything?
No.
Okay, so there's another way that we can also do this test is I can also tap from your first finger here all the way up to your elbow. So we'll just go like this. Do you feel anything?
Sure.
If they feel numbness and tingling in the thumb, index finger, middle finger, and the lateral half of the ring finger, in other words, the distribution of the median nerve, and if they feel those symptoms for more than 1 minute, that would tell us that it's a positive test.
Today I'll be demonstrating Finkelstein's test, which is a test designed to identify de Quervain's tenosynovitis. The test has 3 phases. I'm going to be starting with phase 1 and progressing all the way through. Hi there.
Hi.
For the next part of the exam, we're going to be taking a look at where your pain might be coming from and where the injury may have occurred at. So I'm going to do a couple of tests. To start, I'm going to have you rest your elbow right on the table with your hand hanging off the edge. Good. You're going to bring the pinky side down of your hand all the way down towards the floor. Any pain with that?
Nope.
Okay. Since this part of the test did not evoke the patient's pain, we're going to move on to the next phase. For this part, I'm going to grasp your hand here, and I'm just going to slowly kind of bring you down. Any pain with that?
Nope.
Good. Okay, since this also didn't provoke the patient's pain, we're going to move to the third and final phase of Finkelstein's. Now for this phase, I'm just going to grasp your thumb here, bring you inwards. Any pain with that?
Nope.
No. Okay. So this patient had a negative test, but a positive finding of this test would be reproduction of the patient's pain over the first dorsal compartment of the hand.
Today I'll be doing the TFCC test. This is to test for a lesion in the TFCC. Hello ma'am, how are you?
Fine, thank you.
Today I'm going to just be moving your hand and wrist around just a little bit and you let me know if there's any pain, okay?
Will do.
Alright, so I'm going to have you put your elbow up on the table and then I'm going to hold your wrist here. So now I'm just going to take your hand down, apply a little bit of pressure. Is there any pain with that?
No.
Okay. So a positive test would be crepitus or reproduction of pain, and this may indicate a tear in the TFCC or ulnocarpal abutment.
Today we're going to be doing a lateral glide of the TMJ. Some reasons as to why we would do this is, for one, we could assess to see bilaterally if there's any hypomobility of the joint. In addition, we could see if there's any hypermobility due to integrity issues of the lateral temporal mandibular ligament. We could also do TMJ lateral glides to alleviate pain, also to provide more mobility. Today we're going to be doing what's called a lateral glide of the TMJ, and basically what this means is we're just going to I'm going to move your jaw around to help gain some more range of motion and to alleviate some pain. Is that okay with you?
I am okay.
Perfect. Just want to let you know, in order for me to do this, I'm going to grab onto one of your teeth very lightly with a clean glove. We do this is it will help promote the treatment and help you regain more range of motion through the glides, which is essentially moving the jaw around. Is that okay with you?
I am okay.
And I'm just going to have you open your mouth, and I'm going to grab onto that second molar. So I'm going to grab onto that tooth we were talking about, okay?
Okay.
So this is the second molar that is on the lingual surface. And from here, we're going to just provide an inferior glide going down that way. And from here, now we're going to do a lateral glide towards the patient's ear. Perfect. And from here, we're just going to oscillate for 30 seconds, and we could do this for 3 to 5 cycles.
Today I'm going to be performing the bimanual loading of the TMJ. With this test, my patient is going to be biting down on the tongue depressor on both sides at the same time. And this essentially compresses the central and medial structures of the TMJ. And this test, along with the unilateral loading and distraction of the TMJ, allows the therapist to determine what specific structures and what's the source of the patient's pain. Hello, my name is Sheena Patel. I'm a student physical therapist at the University of Pittsburgh. So today I'm going to be performing a test called the bilateral loading of the TMJ or your jaw. And as you bite down on this tongue depressor, it's going to compress some structures, which allows me to see what specific structures are causing your symptoms and pain. And then with this test, you're going to let me know if you have any pain or discomfort as you bite down on the tongue depressor. Is that okay with you?
Yes.
I'm going to plug this in your mouth. Good. Alright, so any pain or discomfort with this?
No.
Okay. So with the bimanual loading test of the TMJ, a positive test would be pain or discomfort and reproduction of symptoms within the central and medial structures of the TMJ. And then a negative test would be no reproduction of pain or symptoms. And with this test, you want to compare and observe bilaterally.